Well, you may not know this, but March is colorectal cancer awareness month. And our next guest says it is a great time to remind you to get that all important screening. Perhaps you put it off last year because of COVID-19. Well, you can't do that anymore. Joining us this morning is Dr. Scott Steingard. He is a primary care physician at OptumCare Primary Care. He's here to slap our hands a little bit if you put that screening off, because it's so important. Dr. Steingard, why, especially this March, is it important to remind people?
Well, it's obviously, thanks for having me. This past year, not everybody was concerned about going to the doctor. They got a little nervous. They were concerned about maybe their safety for COVID, and we certainly appreciate that, but your body doesn't necessarily understand that problem, and colorectal cancer keeps going, and it's a common problem in the United States. It's a common problem worldwide, and it's a preventable problem. So we need our patients to come in, particularly our 50-year-olds and over, but we need to get them in because that's the beginning stages of how we get to a screening for those people.
And here's what's so scary about colon rectal cancer is that, especially in the very beginning stages, you may not even know you have cancer. So let's talk about two important reasons to come in. First of all, family history. You said age 50, but if you have a family history and you're not 50 yet, should you be screened?
Yeah, you should definitely go in and talk to your doctor about that. Colorectal cancer is a silent disease at first. It starts with a problem called polyps, and polyps are small nodules that grow inside your intestines. You would never know they were growing in you. It's not like you can feel them. The only warning sign you may have may be some blood in the rectum or in the stool as you go to the bathroom, and even that may just be something as simple as a hemorrhoid. So when you're young, under the age of 50, you may not even consider that a problem, but if you have a family history, your doctor can take you into that next step, which would be a screening colonoscopy. Once you're over the age of 50, then you want to come in no matter what. You definitely want to come in and get that checked, get the screening, because it's an easy fix.
Okay. Well, the screening's not easy. I'm just not going to lie. Let's just be honest here, Dr. Steingard. Screenings are not fun. They're just not, but they're so important because it can save your life. What do you want people to know who are over 50? I've heard different stories about how often you should get a screening. Can you clarify?
Sure. So let's start with the very beginning. If you've never had a problem and you're over the age of 50, go see your primary care doctor, get checked. If you've had a problem in the past, give that to the doctor to let him, there's an algorithm that we follow for how often to get screened, and it's sort of complicated, and it's probably better to let your gastroenterologist do that with you. Okay. But the important thing is to start. Most people tend to ignore these problems if they don't have to. And when I said colonoscopy is easy, the truth is that when you have it done, you won't remember it. You have anesthesia, and it's safe, it's effective, and boy, is it important.
Absolutely. Yeah. No, you're right. The actual procedure, you don't remember it at all. It's very easy. It's the procedure. It's the leading up to it. It's not fun. Everybody who's had it knows what I'm talking about. But so important. Don't let this go, everyone. Thank you very much, Dr. Steingard. I want to give viewers at home some information. If you'd like to visit OptumCare Primary Care at Bethany Home, they're at 5830 North 19th Avenue in Phoenix. Call 602-336-1966, or you can visit the website to learn more. Make your appointment at optumcare.com/PhoenixCare.